Disaster. What you guys missed right before the camera went on was that I dropped an entire pitcher of water all over my hardwood floors and was racing to try to get it cleaned up and then back with you in time allotted. So if I seem a little flustered, that's why, but that's what happens when you do live classes. So super fun. This coming week, you're going to get an email, and contained within that email is going to be all of the slides that I used today, not the presentation part, but all of the slides you will get. So that's coming to you. You're also going to get any links to any websites that I happen to mention throughout our time together. I don't really think you need to write anything down, but if you're a type A person, right, raise your hands. Type A people unite. You will know who you are and you'll probably take notes anyway. But I don't think you need to do that. We're going to send you all the information that you need. All right. So I am really fond of this sort of format that we use at the Baby Academy because I do know that questions come up. And when you have an actual person in real time that can answer your questions, you start thinking of all of them. So I am here to answer any questions that you have. I will certainly try to support you and answer as many questions as I can in the time that's allotted. We have 8 topics to go over, so we'll do the first 4, and then we'll open up the live chat to take some questions, and then we will, in the second half of the class, go over the last 4 topics, and then at the very end, we'll have another question and answer session, and I will try to answer as many questions as I can. The one thing that I would ask of you, if you could, especially in that first 4 topics, the first half, if you could keep your questions limited to the topics that I'm covering, that will help us to stay on time. So I know there's lots and lots of questions that may be outside of the things that I'm covering. Hold those till the end, and I'll get to, I promise, as many as I can. Just important for me to be able to stay on time to get all of the information that we have for you this morning. We are here to support every single one of our Baby Academy attendees. So you're going to hear me use the word partner, and I really just mean that to be whoever happens to be walking on this journey to parenthood with you. We will have time for a break because this is a lot of information. Usually, I'll go through 4 topics and then we'll do questions and answers and then we'll take a break, somewhere between 10 and 15 minutes usually. And then we'll come back and hit the second half of our class. The first 4 topics will take much longer than the second 4 topics. The second 4 are a little bit easier content wise to get through. So, usually, we'll be together here for about 45, 50 minutes of didactic work and then a little bit of time for questions. Then we'll get our break in. So, a little bit about me. I've been a nurse midwife for 30 years, a very, very long time. I'm a dinosaur in this profession. A lot of midwives retire after 8 to 10. It is a very demanding profession, but I would probably say one of the most rewarding. So, I get the honor of being invited into people's lives to share in moments that are just, lifelong memories. And I certainly am grateful for that. And I feel blessed to be part of that. I have 4 children myself, so I have walked this journey to parenthood 4 times. I've had a miscarriage myself. I certainly know what that feels like too. So a lot of my instructions for parents are, from my personal experience. So throughout our time, you might hear me throw in like a mommy tip. I'll say, mommy tip, listen to this. And those are just things that I've found that have worked for me above and beyond what the evidence says. So all of our classes are evidence based. There is, no hearsay here or there. This is all based on scientific fact and evidence, and you can sort of research everything that we say here in our classes. But occasionally there are things that come up that, regardless of what the evidence says, sometimes there's a mommy tip you can throw in that will make your life a little bit easier, and I will certainly throw those in today. I like to know who my audience is. I think we have a decent sized class today. Yes, we do. If you wouldn't mind typing in your name and where you're from, and if you're having more than one baby, I'd love to do that. I'd love to know that also, and maybe when your babies do, that would be great. There's a tiny bit of a delay from the time that you start typing till the time I see your answers, but they will certainly start to come in relatively quickly. So we'll see who's here with us this morning. All right, all your answers are going to start to come in, and I am going to go ahead and talk about our game plan. All right, so we're going to start with bathing your baby, skin and nail care, then changing diapers and cord care. Now I see where you're all coming from. Hello, Jennifer. Hello, Kara. Shannon from Connecticut. So we have lots of people from Louisiana. There's a state I've never been to. Lots of people up and down the eastern part of the United States and into the Midwestern part. So everybody's starting to come through now. Clarice from Georgia. Welcome to everybody. So as I said, our game plan is up here: bathing your baby, skin and nail care, changing diapers, and cord care. When we get to cord care, excuse me, when we get to cord care, know that your first break is coming. So right after cord care, we'll take a little bit of a break. All right. And then when we come back, we're going to come back and talk about dressing your baby, safe sleep, hugely important topic. Safe swaddling guidelines for that have changed, excuse me, in the last couple of years. And then we're going to talk about temperature control for your baby inside your home, outside your home, and then temperature control inside your house. What will make baby comfortable? What will make baby uncomfortable? All right, so let's talk about bathing your baby. Now, if you're thinking about like how often, what do we use, we're going to cover all of that. But for just a second, I want you to think about where the baby comes from, right? In utero, they are living in water. That's it. They're in utero, they're in water, so their skin has to be protected by something. And so their skin is protected by a very thick coating of like a buttery type of a substance that's called vernix. So vernix serves as Mother Nature's sort of natural moisturizer as well as Mother Nature's natural skin protectant. And that's what we are using or not using. That's what covers baby skin. That's what's going to protect baby skin in the first 4 to 6 weeks post delivery. So when we talk about bathing your baby, and this is why I bring this up before we get into the actual slide that talks about it, this is why we say to people, really, ideally, you only want to bathe your baby once a week for the first month to month and a half. And that is because we really don't want to wipe away what Mother Nature has worked so hard to give baby to protect his or her skin. So, really, they're not getting that dirty in the beginning. And the parts that are getting dirty, we're certainly going to clean on a daily basis. But a head to toe bath, only necessary about once a week. Now, think about water temperature. It's actually not even the water temperature that's important. It's like, what's your body temperature? Average body temperature is about 98.6. Now, that does not mean that you need to get a thermometer and put it in the water and start adding hot or cold water until you get to exactly 98.6. What it means is that you need to be able to put the water somewhere and let it feel comfortable on your skin before it touches your baby's skin. So most of us would just put our hands, and I have a little baby bath here. I'm not sure if you can see that right here. Most of us would put our fingers in, but putting your fingers in the water is actually probably the worst way to check water temperature because our fingers are calloused because we touch so many things throughout the course of the day that they're much less sensitive to temperature. If you take a little bit of your water and you put it on the inside part of your arm, this is much more sensitive to temperature, right? So fingertips less sensitive, inside part of your arm much more sensitive. So if the water temperature feels comfortable to you here, inside part of your wrist, inside part of your elbow, or the inner arm, it's going to feel comfortable to your baby. If it feels cool here, it's going to actually feel even cooler to your baby, and the opposite is true as well. If it feels a little bit uncomfortably warm, it's going to feel hot to your baby. So you almost want to feel the water and have there be like very little reaction, right? It just feels very comfortable on your skin. Then you know it's good for baby, right? So close to body temperature is what we're aiming for. This is my little baby that I'm going to be using to demonstrate today. I'm going to call her Paige. I've been calling her Paige for the last couple of classes I've taught. Before that, it was Harper. I don't know. I just pick a new name every time. You want to make sure that you have everything that you need before you get started. So you're going to need your newborn. You are going to need a washcloth. You're going to need 2 towels. I actually have one because when I dropped this entire pitcher of water, I threw my other towel down on the floor. So I'm going to just make do with 1 towel, but usually you need two. One to put down on your flat surface where you're going to bathe the baby, just to make it a little bit more of a comfortable flat surface, not so hard. And then the second one to dry the baby. I usually tell people to have a nail file close by, and then some, usually like cosmetic rounds. I don't have them with me today, but generally those small little cosmetic rounds that you would use to like put toner on your face or take makeup off. I think that those are great for cleaning babies' ears because we really don't recommend using Q-tips for babies' ears. They're also great for kind of teasing any kind of mucus out of the nose as well, as opposed to the bulb syringe that you get in the hospital. So here is a list of the things, and you're also going to need a diaper. I forgot to mention that. A little diaper to put on the baby after your bath is done, and then a fresh outfit. I'm going to certainly put her back into the outfit that I have her in because she's not a live newborn. I'm going to start to get her ready. Think about the areas that are going to get dirty, and those are the areas that we're going to clean on a regular basis. So their little hands, their little feet. Um, when we're nursing a baby, the nape of their neck, formula, or breast milk can always sort of drip out of the corners of their mouth and end up in their neck. We're going to clean those areas daily. Their little face is going to get, cleaned on a daily basis as well. We don't recommend that you use baby care products. So no soaps or shampoos for the first 4 to 6 weeks. That always raises eyebrows as well. Why not? Why can't I use like Baby Magic or Johnson and Johnson? Why can't I use any of those products? So babies are just getting used to their extrauterine environment when we first welcome them earthside, right? So we try to limit the amount of chemicals that we're putting on baby skin. Your skin, my skin doesn't really react to too much because we've been here, a heck of a lot longer than this newborn that just arrived. So we really do try to limit the amount of chemicals because they have a hard enough time just adjusting to the environmental pollutants, environmental allergens, things that you and I don't react to. That's enough of a stress on babies, brand new, integumentary system, their skin. So we're going to be careful not to put too many products on the baby if we don't need them. Right. So we'll talk about the things that we might need, but if you can limit the amount of product that you put on baby skin for the first 4 to 6 weeks, that's ideal. All right. So when we talk about bathing your baby, I have gone ahead and I have undressed my little girl here. I am going to make the camera a little bit easier for you to see what I'm doing. You might not see me, but I want you to see her. Couple things that I want you to be aware of. Little newborns have very underdeveloped neck muscles, right? So if their heads are leaning forward, they will fall forward. If they're leaning back, they'll fall back. So it's very, very important that we always protect the back of the head because they don't have the ability to hold their head up, right? So there's a couple ways you can do that when you're bathing. You can take your thumb and your middle finger and slide it right along the jawline of the baby. That way, your index finger just rests on the back of the baby's head. That's enough neck support there that will work well. And you have a free hand to go ahead and bathe your baby with a washcloth. The other way that you could do this, if this seems like too difficult, or if you have larger hands and a smaller baby, it might seem a little hard to navigate. You can simply rest your hand, put your thumb and your middle finger around the baby's shoulder, and then go ahead and just rest the baby on the inner part of your arm. And then you have your free hand to go ahead and bathe. Then, when you're switching positions, look at your slide that you're looking at right in front of you. That simply is changing baby's position, leaning them forward and holding on. And then again, you have a free hand to bathe. So I do like supporting the baby's head. The other question I get oftentimes is, could you use a little baby bath and put the baby inside the baby bath? 100% yes, you could. All right, that's fine. The one thing to remember when you're bathing a newborn is that you do not want to get the umbilical cord wet while it's still attached. Once the umbilical cord separates, the belly can get wet. That's not a problem. But we're trying to keep the umbilical cord while it's still attached for the first week or two as dry as possible to facilitate it falling off, right? We don't want to make it stay on longer by wetting it, right? So I don't always think that this inner like sort of baby bath type of a setup is great for the first week or two. I actually think a sponge bath on a flat surface works a little bit better. But certainly your baby, your choice, you could certainly do this. I only have inside of this baby bath about an inch or so of water so that I'm not getting, her belly very wet. But just for the sake of argument, I'm going to do it this way, just so you can see what I'm doing, because I do think that this works a little bit better when a newborn is very, very young. You just kind of hold them so that we're supporting the back of their neck, right? And we're going to go from the top to the bottom. So you start at the top of the head, couple little turns of your washcloth, and this is just an adult washcloth. Could you use a baby washcloth? Sure. This is an adult textured washcloth. I like it. It's cotton. It's easy. And I'm going to go a couple turns in one direction and then a couple turns in the other direction. All right. And that's just going to help to loosen up any skin cells that are on top of the baby's head, cradle cap. That if it loosens it up, I can go ahead and comb it out or brush it out of the baby's hair. So that little circular motion feels good to the baby. It's actually very comfortable. Who doesn't like a little head massage? Then we're going to move to the baby's face. Usually, I'll take one finger. This is how they're going to teach you in the hospital. One finger, come down the bridge of the nose, go from one side of the baby's eyes to the outer corner, inner to outer corner on both sides, then come down the cheeks on both sides, right? And in the nape of the neck. Okay, that's fine. It works well. But here's a little mommy tip, right? Think about somebody touching your face over and over again. That's not really very comfortable for a newborn, even though it's completely appropriate. I usually take my wet washcloth, my whole hand behind the washcloth, and while I'm talking to her, okay, Paige, let me get your whole face nice and clean. I did the entire face in one foul swoop. That way, she only feels one time somebody touching her face as opposed to this, which can sometimes feel a little bit uneasy for a newborn. So that's just a mommy tip. Okay, both ways are completely appropriate. Again, your baby, your choice. You'll find what works for you. Then I take a new area of my washcloth. I'm just going to go ahead and wet that and wring that out. And I'm going to come down and get the arms clean on both sides. A newborn baby is much easier to raise their hands up. The doll is a little bit harder. I'm going to go ahead and get the chest clean, and I am stopping north of where the umbilical cord would be attached. Okay, so the umbilical cord would be attached here. I'm going to clean everything north of the umbilical cord. This is a good time to change your position. Okay, so then I'm going to take the baby. I'm going to let the baby lean forward. Now the baby's leaning on my wrist, right? We're not choking the baby in any way. I'm going to wet my washcloth, and then I'm going to go ahead and I'm going to clean the entire back of the baby. Back of the neck, entire back. I'm stopping north of the buttocks. Then I'm going to support my baby's head, and I'm going to go ahead and lay the baby down, right? She's totally fine there. I'm right here, no risk of fall. Again, wet my washcloth. I'm leaving the genital area for last. Always leave the genitals for last because that's the dirtiest area. Go ahead and get the little feet clean. The arms, the legs have all been done now, right, on both sides. And then the only thing that's left is the genital area. With a little girl, you take one finger. You go from north to south, top to bottom, one time. That's it, right? You don't need to get in there and start rubbing. This is very delicate tissue, very uncomfortable. So one time, top to bottom, and then usually getting the entire buttock area. Now, if it's a little boy, same thing, one finger. You go on one side of the scrotal sac, the opposite side of the scrotal sac, right? Top of the testicles, and then the buttocks. And the only thing that's left is the baby's penis. Imagine this is the baby's penis. You're going to take a little bit of your water with your fingers and you're just going to drip it down on top of the penis. If it's a newly circumcised baby boy, you do not want to get in there and start rubbing. That is very, very painful. You'll have a very, very unhappy young boy. So you want to go ahead and just take a little bit of water. And then if there's anything that needs to be sort of cleaned away, you just dab very, very gently. Now, if it's an uncircumcised baby, you're choosing not to circumcise your little boy, you certainly can do the same exact thing. You're just going to take with a free hand, you're going to stabilize the penis, not retract. You're not retracting the foreskin down so that the head of the penis comes through, not at all. You're just stabilizing it so that you can see the very tip of the penis. And then again, that little water drip down method, I think works great. And then if there's any stool or anything that needs to be cleaned, you just dab it very gently, right? The genital area doesn't really need to be scrubbed, right? Because you're going to be cleaning it so frequently that it really doesn't get all that dirty because we're changing diapers like, 8 to 10 times in a 24-hour period because we're feeding every 2 to 3 hours. So I'm going to just manipulate my towel here. I'm going to use my baby blanket as if it's my towel because my second towel ended up on the floor. But let's just say this is my second towel, okay? So then I'm just going to go ahead, place that down. I'm going to put my baby down, and then I'm going to wrap my baby up in the towel, okay? Now, really, at this point, all I'm going to do is just kind of hold on to her and dry her like this so that she's comforted, right back in my arms because they'll always be more comfortable in your arms than away from your arms. So I'm going to keep her close by, let her know everything's okay, and then I'm going to go ahead and finish with the rest of my sort of bath time stuff, which might be, nail filing or putting a little bit of lotion on the baby if there's dry skin and only if there's dry skin. We're trying to limit the amount of chemicals that we put on baby skin, so I don't usually recommend that you use any kind of lotion with every single bath, right? Only if their skin looks a little bit dry. So normally I would put the diaper on and I would go ahead and get her dressed. But because we're going to touch on those topics, I'm just going to kind of leave her here with me after her bath. Okay? Perfect. So let's say the time comes and you're thinking, what did Chris say? How many times a week do I do this? Like, what do I use? Do I use products? Do I not use products? We have an Instagram page that you can go to at the Baby Academy US. And we have lots of videos there that cover a lot of the content that we teach in our classes. So you can certainly feel free to check that out. Let's talk next about baby skincare, baby's nail care. These are important topics that oftentimes get missed a little bit in the instruction period when you're delivering at a hospital or a birth center. So, when we talk about dry skin, I think parents think dry skin is way more common than it actually is. It's common with a baby that is overdue, right? Baby that's post 40 weeks. Excuse me, I have like a little tickle in my throat. Dry skin doesn't really happen in babies that are 37, 38, 39 weeks. 41 and 42 maybe, and it looks very much like dry skin looks on an adult. You can see like little cracks in the baby skin, sometimes even it peels a little bit. That is considered normal, and that's an instance where I might go ahead and put a little baby oil or coconut oil. I like coconut oil better than baby oil, to be very honest. I think coconut oil is a natural oil that babies tend not to react to very often. So most babies do very well with coconut oil. It's a natural moisturizer, it works fine. Now, could you use like a product made for babies? Sure, you could, some kind of a moisturizer. However, I would choose a fragrance free option, especially in the first 4 to 6 weeks, simply because, again, we're trying to limit the amount of chemicals on baby skin. So natural oils are fine. Olive oil, avocado oil, apricot oil. There's all those natural oils you can use, but coconut oil tends to be the one that babies react to the least. Newborn rash. Let's look at this slide. I have a little pointer here. Let me show you this. This is something you are very likely going to see on your newborn. So take a good long look at this. I just outlined this big patch of newborn rash. So why does that happen? It happens because baby skin, which has been in a sterile environment in utero, is now earthside, earthside outside the uterus, and it's getting used to all the things that are in the air that are just environmental allergens. You and I don't react to them because we've been here longer. So those newborn rashes tend to come on very quickly in the first week or two after birth, and they go away very quickly as well. So they come on quickly, they go away, usually gone by about 2 weeks of age. So your baby skin is going to be looked at by a pediatrician before you leave the hospital. If you're delivering at home or in a birth center, you'll likely bring your baby to the pediatrician within the first 24 to 48 hours. So, they're going to look over your baby's skin. And if they see an area of newborn rash, they're going to alert you to that. Take a look at this. This looks like typical newborn rash. Now, what if you see something that looks different? Right? Looks like above and beyond what the pediatrician mentioned to you. That's an instance where you might call your pediatrician and just let them know. So, newborn rash looks very much like this slide. However, if all of a sudden something changes, it changes color, or the baby, is starting to wiggle a little bit as if almost like it were itchy, right? If baby's starting to move around, trying to, comfort himself or herself. Those are instances where you might want to call the pediatrician and just check in and just explain to them what you're seeing. Okay, let's talk about milia. Milia is commonly referred to by new parents as baby acne. However, it is nothing of the sort. It is not acne at all. What it is oil that rises to the surface of baby's skin, and it does present as these little whiteheads that you can see. This top slide is a great Example, see these tiny little whiteheads? Again, type A people unite, right? I know what you're thinking. I could get in there and squeeze that stuff out of there. No, not in a million lifetimes do you want to get in there and squeeze any of this stuff. There's no greater way to initiate a skin infection than to treat these as if they're pimples. They're not pimples. So, while it is a little bit unsightly, you can see it here on this newborn, as sweet as this baby is. You can see that little newborn rash. While it can be a little bit unsightly and somewhat of a stressor for new parents, the best thing to do with this is to leave it alone. Let it be, let it go away on its own. Now, while newborn rash comes on quickly, goes away quickly, milia comes on a little bit more slowly. Could take a couple weeks to see it, and it's going to take several months to go away. So, usually by the time a baby's 5 or 6 months of age, there's no more milia. But up until that point, it is very common, and you may see it. So I want you to be familiar with what it looks like, so you're not sort of shocked. Now, do not use acne care products on milia. So no Stridex pads, no Clearasil pads, nothing, no Oxy, none of it, because these are not pimples, right? So those products are way too strong for newborn skin. So we just leave it alone. I've had some women ask me, can I put breast milk on that area? The short answer is it's your baby. Of course, you can put your breast milk on that area. And I certainly understand the idea behind it because breast milk, has antimicrobial properties. However, my personal opinion is the best place for breast milk is inside your newborn, right? Let them ingest it. Don't necessarily waste it to put on their skin because it's like liquid gold and your baby can really use those antibodies. But is it going to hurt the baby if you put breast milk on milia? No, it's not going to hurt your baby. Might it help? Maybe. I don't know of any studies that actually have looked at that specific topic, but certainly you could try it if you wanted to. I just think breast milk does its best work when it's ingested by your newborn. Okay, let's talk about babies' nails. So there is nowhere, not one hospital that I have ever worked at, and there have been several, where a nurse will come in and say to you, I went and trimmed your baby's nails. Nursing staff is instructed not to touch your baby's nails, okay? And that is purposeful because it's just too easy on a newborn to go ahead and trim baby's nails and accidentally cut baby's skin. So newborn nurses are usually taught do not in any way shape or form trim baby's nails. It's not recommended. So that is going to be 100% your job. Now, what can you use to change nails? We'll talk about diapers in 1 second. What can you use to take care of baby's nails? There are newborn baby scissors. There are nail files. There are electric nail files. There's so many different ways to trim your baby's nails. This is what I use. This is just an adult nail file that has a coarse side and a fine side. I use the fine side of an adult nail file. If you wait till your baby is sleeping, right? You can let me go back to that slide because I think it discusses that. Yeah. If you take two fingers and slide it inside your baby's palm of your baby's hand and just expose the four fingers, it's very easy to go ahead and file the baby's nails right then and there, and then you can do the thumb separately. Okay, babies will not generally pull their hands away while they're asleep. However, if you try to do that when your baby is awake, yes, oftentimes they'll pull their hands away. That's why we try to wait until your baby's sleeping before we go ahead and trim their nails. All right, let's talk about changing diapers. Here's changing diapers 101. This is pretty easy stuff. So always wash your hands before and after you change a diaper, right? That's pretty common sense. So when we talk about wet diapers, when your baby wakes up for a feeding, check the diaper. The likelihood is that it's going to be wet. And if it's wet, you're going to go ahead and you're going to change the baby's diaper. All right. So every time your baby wakes up for a feed, check the diaper. If it's wet, change it. But let's say you've just changed a diaper and now you're feeding your baby and you know that the baby's pooped. Even though the diaper might be dry, doesn't have urine in it anymore, if there's poop in there, do we change the diaper straight away? Yes, we do. We don't wait until the next feeding and let the baby sit in a poopy diaper. So what, stool is simply just waste products, and we don't really want that against baby skin. That's how diaper rash starts. So newborns don't actually get diaper rash all that often because we're changing diapers every 2 hours, right? because we're feeding every 2 to 2.5 hours. Maybe with a bottle feeding baby, you might feed every 2.5 to 3 hours, but still, we're changing a lot of diapers in 24 hours. So we don't tend to see diaper rashes frequently in a newborn. You do tend to see diaper rash when babies start stretching out their naps. They take longer naps and they might be sitting in wet and or dirty diapers for any length of time past an hour or two. So there's no need to necessarily put product on your baby to protect them from diaper rash. I mean, certainly it's your choice, but there's no need to actually use any product because we are changing diapers so frequently. So with little boys, this is important. You want to try to not have the penis pointing up towards the baby's belly button. That's purposeful because that is just too easy to have leaks and accidents that way, right? Because babies are going to urinate upwards if the penis is pointing up towards the belly button. So we try when we're changing a newborn baby boy to have their penis pointing up towards the ceiling as we close the diaper over the penis. And that just helps to keep that umbilical cord area clean and dry because if the penis is pointing up towards the belly button, then that area of the diaper is going to be quite wet. That could actually, we could run the risk of the cord actually getting a little bit wet with urine. So with little girls, just like with the bath, when we talk about cleaning them during a bath from top to bottom, we do the same thing when we're cleaning a little baby girl when we're changing her diaper, right? We're going to go from the top of the vagina down towards the rectum and then clean the buttocks. Little baby girls oftentimes have a little vaginal discharge. It's common. It's called pseudomenses, which essentially means fake period. It can be whitish, it can be clear, it can be sort of mucusy, can actually have a very, very faint pink tinge to it. That's normal pseudomenses. But if a baby is actually bleeding from the vagina, that is never normal. And that is something you want to call your pediatrician about immediately. So I just want to make you aware that little baby girls can sometimes have this discharge for the first week or two after they're born. Not every baby girl will have it. But many will, and I want you to be aware of it. It does not happen to little boys, only little girls. So if you see a discharge, you're not going to get in there and start to try to like pull it out of the vagina because it can be feel like it's attached. Leave it there. Wipe away what you can, put the diaper on, and then the next diaper change as she continues to urinate, right? She will rid herself slowly of that little bit of discharge that's there. So wipe away what you can. Don't be too aggressive with it. You don't need to use Q-tips to put in the vagina, nothing. Just one wipe from top to bottom. So here's what we're using for diaper changes. You can use just warm water and those little cosmetic rounds that we talked about. These are like my favorite products. These are called water wipes. You can find these at Walgreens, Target, CVS, Piggly Wiggly, like your local grocery store usually has them. But these are 99.9% water and dry wipes, right? It's just the dry wipes that have been pre moistened with water. This is such a brilliant idea. I can't believe I didn't think of it first. But these are super. They're not fragranced, they don't have any chemicals in them. They're simply wipes that are soaked in water. So I love these. They're, certainly not expensive, maybe a couple dollars, but you could make your own with paper towels and water, put them in a plastic bag and do it that way. That would be completely appropriate. As I said earlier, you do not need to use like diaper creams, diaper rash creams, anything like that, unless a pediatric care provider says to you, "Hey, take a look at this. I really want you to see this little rash, and I think you should use this product, whatever this product might be." So if a pediatric care provider makes the recommendation to use a product, then I would go ahead and say, "Yep, okay, I'm going to go ahead and use that product." But for me, just to take it upon myself to do it in a healthy newborn, I don't think it's necessary. Okay, I know it's a little bit early at like 10:05 in the morning to be looking at all these different types of poop, but the truth is, these are diapers that you are likely going to see in the first month of your baby's life. And so we should probably just be familiar and get used to what they look like. So, this first diaper on the top left of your slide is called meconium. It's baby's first stools. You see this on day one, day two, sometimes day three after birth. Very dark, tarry, thick substance. A little bit harder to wipe away, but certainly, like, people think you need like a Brillo pad. You don't. You might just have to wipe with an extra wipe to get it off. That is something you are 100% going to see because every baby has meconium stools. Sometimes they let it go as soon as they're born. Literally, they come from the vagina right up onto your chest and they start stooling. The hope is that you get a diaper on the baby, that the nurse puts a diaper on the baby before that happens. But sometimes we have a baby full of poop and then we get full of poop too. So that is something you're likely to see, totally normal. As the baby starts taking in either breast milk or formula, the consistency of those stools change and they become very watery and almost like diarrhea like. And that's normal. So baby is taking in liquid, they're going to put out liquid. Babies do not have formed stools, okay? It's liquid. So you're going to see top right, the baby after day 3, 4, sometimes even into the fifth day will have this brownish liquidy diaper. Totally normal. All right, that's what you're expecting. Then, as baby's liver, the organ inside the baby's abdominal cavity, the liver, is born immature. So at birth, babies have an immature liver. The liver processes a substance called bilirubin. Bilirubin is like a bright yellow, almost like a mustard yellow colored substance produced in the liver. And while the baby's liver is immature, they can't process it. They can't excrete it. So once the baby's liver starts to mature, what you're going to see in the diaper is a big change in terms of the color of the stools. They're just going to be mustardy yellow. It can be seedy in consistency. Those are normal changes for a newborn at the end of the first week of life. So you'll see it goes from this black to brown to yellowish type stools, very common. And then somewhere at about day 7, 8, 9, you're going to see a combination of this brownish and yellowish diaper, and that's what you'll see sort of moving forward into the next several weeks of the baby's life. So while this can be a little bit unsettling to look at, it's important because your baby is going to have all four of these diapers. So this is something 100% you're going to see. All right, so time to change a diaper. How do we do this? Let's talk about cloth diapers versus um, disposable diapers. All right, and I have both, right? Little cloth diaper, which very much looks like this. The cloth diapers that are available now, they are Velcro, right? Very easy to utilize, very easy to work with. The older cloth diapers used to have safety pins, and I think that that was very difficult to keep that on the baby using a safety pin. They would leak often, but these new Velcro type of diapers are much, much easier to work with. So, what are the benefits of using your own cloth diapers versus disposable diapers? So, the benefits are they're a little bit more environmentally friendly. They certainly can be less expensive if you're going to launder them yourself. The and listen, if you're very environmentally conscious, cloth diapers might be your choice. It is 100% a personal choice what you're going to use. I found for me, I was a busy working mother. I didn't have the time to be washing diapers. And as a new mother, many years ago, I didn't have the money to hire a laundry service to clean the diapers. So disposable diapers are the route that I went. They say that you actually end up saving about $1,000 over a 2-year period, so $500 a year, if you're going to use cloth diapers. So if you want to pay attention to your budget, if you're going to launder them yourself, you could save about $500 a year. That's the estimate. Disposable diapers, right? Not as environmentally friendly, but super convenient, I think is what most people choose to use on their newborns. And really, again, it's personal choice. I always get asked the question, which brand, what brand of diapers? And honestly, I think it really depends on a couple of things. It depends on your budget. I hear people say to me that the cheaper brands like Love's and Costco brand and BJ's brand work just as well as some of the more expensive Honest Company, Pampers, Huggies. Look, disposable diapers are expensive, right? They are expensive, and really they have one job to do: not leak. That's their only job. Don't leak. And so, whatever works in your budget, I usually don't recommend that people buy like cases and cases of one branded diaper because if you don't like it, you're stuck with them. So, maybe buy a couple packages of different brands and see what works. I always had heard Huggies for boys and Pampers for girls for whatever reason. I did follow though. That's sort of where I went. My boys use Huggies diapers; they didn't leak. My daughter used Pampers diapers; they didn't leak. I use Love diapers. I've used them all. So I think it's really what works for your budget. All right. So when we're changing a newborn, this is not a two-person job. It is a one-person job. But in the beginning, lots of parents make it a two-person job, and that is 100% fine as well. But really, if you just secure the baby's legs, if you take one finger and put them right in the center of the baby's ankles, your thumb is going to wrap around one leg and your middle finger will wrap around the other leg. And then you have control over the baby, whether you want to turn the baby sideways and put the baby's diaper on that way, and then, go ahead and roll the baby onto the diaper, or simply lift the baby ever so gently, not like this where you're going to hurt the baby's spine, but lift the baby ever so gently and then slide the diaper underneath. You're going to go ahead and bring the diaper right up between the baby's legs. All right. And then you're going to secure it with the tabs. And if this is a cloth diaper, you would secure it with the Velcro. I'll show you with the cloth diaper as well. Now, the thing that's important with a newborn is while their umbilical cord is still attached, we want to make sure that that lays outside of the diaper. All right. So because this is such a small baby, even my newborn diaper, if I pull it up, will come all the way almost up to her nipple line. I need this diaper to be underneath the umbilical cord. So I'm simply going to fold it either down or back. And then I'm going to take my tab. I'm going to bring it around on both sides. And I'm going to secure the diaper. Now you can see here is where the umbilical cord would be attached. It's outside of the diaper. You just don't want the diaper to cover the umbilical cord. Now, if I were going to do this with a cloth diaper, it is the exact same idea. Exact same idea. So here's my cloth diaper, right? I have my Velcro straps. The buttocks are going to go right in the center. Same idea. I'm going to bring the cloth diaper up. I'm going to attach it at the top. I'm going to take my little tabs. I'm going to bring it around, attach it on both sides, and I'm going to make sure that my umbilical cord is outside of the cloth diaper, right? So either one of these are completely appropriate for changing a newborn's diaper. And in the beginning, you do it with two people. One parent holds the legs and the other one slides the diaper under. But truthfully, you could do this with one person, not a problem. Up, can you hear my pups? They're all arguing. Hold on, guys, for 1 second. Hold on. Okay, I'm sorry. I'm running. It's like a little puppy daycare. I'm fostering some puppies, and we try to keep them quiet with bones, but they blew through those, so I had to let them outside and let them be quiet. Okay, so sorry about that. We will move right on. So again, on our Instagram page, we have again videos about diaper changes. We have videos on cloth diapers versus disposable diapers, and you can access that at any time at the Baby Academy US. Let's talk for just a moment. I spend a lot of time talking to my patients about their expectations for new parenthood, their expectations about labor, delivery, and 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 then take that and match it with the reality of what the situation actually is. And this is what I think is important to think about. I oftentimes call, when I talk about delivery, labor, I talk about sort of the fantasy of what we create in our heads, right? Of what we think labor should be versus the reality of sometimes what it actually is. Sometimes we have a very sort of perfect idea in our head of what's going to happen. I'm going to go in the hospital, my water's going to break, I'm going to labor, I'm going to have an epidural, or I'm not going to have an epidural. And then there's the reality of sometimes what actually happens. Because sometimes what happens is, a baby's heart rate actually drops. and doesn't come back up. And then all of a sudden, we're doing an emergency C section. If you don't leave space in your brain for the possibility that sometimes those things could happen, I think what happens is we start to look at our experience as negative, or we look at like our bodies as something that failed in some way, like maybe our bodies failed us. But the truth of the matter is, at the end of the day, if you have a healthy mom and a healthy baby, it's a huge success. So my point is that even with newborns, right? We think we're going to have a newborn that's going to sleep all night long and it's going to be such a good baby, and then maybe you end up with a baby with colic, right? So you have to be very flexible in terms of your ability to change gears really quick as a new parent. It's really important. It's the same in labor. You have to be able to change gears. If something didn't go the way you thought it was going to be, it's not like you're rolling down, running down the rabbit hole. You just have to say, okay, like what's next? Tell me what I can do, right? That's how you have to think in your brain about labor, delivery, new parenthood. So, whatever it is, right? Whether it's something goes wrong when you're bathing your baby, or your labor's not progressing normally, and now we're starting to talk about other options for delivery. You just have to remember that every labor is different, every baby's different, every delivery is different, and so you have to be again able to sort of flip the switch and be flexible. So we use a lot of acronyms here at the Baby Academy in an attempt to be able to deal with change, right? So when we talk about let's follow your ABCs, the A is go ahead and ask for help. Like, who are the people? Who are your peeps, right? Who can you ask for help from? Is that a parent? Is that your partner? Believe me, your partner wants to help you, but I'm going to tell you they're not mind readers. So, ladies, we need to be able to articulate what it is that we need. And sometimes we're not always really good at articulating that. So, you have to start to get really good at communication with your partner. Babe, I'm really, really, really tired. It would be really helpful if I could pump this feeding session and you feed the baby because I can barely keep my eyes open, right? Say what you need, not like, I can't do this. It's too much for me, right? You have to be able to articulate. So the A is always remember to ask for help. The B is where can you find answers? You can browse the internet, right? But if you're asking like midwife Chris, I think the internet, Dr. Google, worst doctor known to mankind, worst place to get your medical information. So browse the web, but browse it with care. Do not believe everything you see on TikTok or Instagram or Facebook. I always bring this example in because I couldn't believe it when it happened. And this is even years ago, this happened. I'm part of a mom's group in the community that I live in, and somebody had posted a picture of her 18-month-old son who had a rash all over his face and body. And she posted the picture and said, we went swimming at a pool, whatever, and now he has this rash. Does anybody know what this could be? I am not kidding. There were 421 answers of everything from that looks like a herpes infection to that looks like fifth disease to that looks like an allergic reaction. Not one person said, why don't you call your pediatrician? So my point is that when people are behind their computers, there's lots of experts, right? When really the experts are your healthcare providers. Those are the people that you want to ask your most important questions to about your health or your baby's health, not TikTok or Instagram or Facebook, right? Lots of opinions all over the internet, as I'm sure you are aware. And the C is you're here, right, in a class format to learn something. So there are classes that are available that can help you get through all of these different stages of labor, parenting, that make it a little bit easier for you. So if we're talking about a childbirth class, what does it do? It helps you to feel empowered. It gives you confidence. It gives you some peace of mind if we're looking at some of the emergency situations that we try to help people through. Not exactly American Heart CPR, but what to do in the case of an emergency, God forbid, if you need to do something before medical help arrives. And then to me, the level of anxiety that I see in women in the last probably 10 years has skyrocketed. And I'm not really sure what that's from, but I know for a fact that it's present. My colleagues and I talk about this all the time. I think I think peri and postpartum anxiety is actually worse than depression, even though the term is postpartum depression. I think the anxiety is worse, and so I think arming yourself with information sort of helps to de-escalate anxiety a little bit, and that's where I think classes can be very helpful. So what can be learned in a childbirth class? These are our childbirth classes, right? Most classes will cover labor and birth. The reason why I like our childbirth classes is because we have a very special section on the fourth trimester, the first 3 months after you bring your baby home, which I'm going to tell you is the hardest 3 months of your life, without question, and nobody talks about it. Nobody talks about like bonding and what happens when you bring your baby home and feeding cues and all of those things. What if your baby's not latching? All of the things that happen. What if I am feeling like a disconnect from my baby? What does that mean? What if I'm not producing enough milk? How do I make that change? How do I help that? So I love our classes for that purpose. That we do talk about those first 3 months postpartum, and that we also talk about baby first aid, choking, and CPR. So we have classes that are designed to give you confidence and make you feel empowered. We do give you the class recording, whereas today you'll get the slides with our classes on childbirth and some of our other new parenting classes. We give you the entire recording so you can watch back. So let's talk about cord care for just a minute, and then we're going to go ahead and take some questions. This newborn baby, this looks like a super healthy cord. Do you see how thick this is? Brand newborn baby. This baby hasn't even been wiped off yet. So this is our section on cord care. And there's not a lot to do when we talk about cord care. So you do not need to clean the cord. That has been actively researched, right? Cleaning the cord versus not cleaning the cord, there is no benefit one way or the other. So you do not have to clean the cord. It will fall off just the same in the same amount of time, whether you clean it or don't clean it. You're going to do your best not to get the cord wet, right? We're trying to keep it dry to help it to fall off. So do not cover the cord with the diaper. Once the cord falls off, you can cover the baby's belly button with the diaper. But until the cord falls off, you want to just keep the diaper underneath the umbilical cord. All right. So you want to let air get to that cord. And then it usually falls off at about 1 week of age. Sometimes it's still there at 2.5 weeks. That's normal. The point is, your baby's not going to go to kindergarten with their umbilical cord attached. Okay. So here is a day one cord. This is a brand new baby. I know this because this umbilical cord is present, and normally the cord is trimmed about an inch or two on the other side of the cord clamp. That cord clamp is put on by your OB care provider, and it's taken off by the nursing staff before you leave the hospital. And then the tissue, right, the umbilical cord tissue actually starts to harden and it starts to rot. It's actually rotting tissue. That's what it is. So it will get very hard to the touch. It does not hurt the baby in any way, shape, or form. And then usually around day 7, 8, 9, 10, 11, you'll simply undress the baby and the cord will not be on anymore. It'll just like fall into the clothing. What do you do with it? You can throw it out. If you want to keep it for their baby book, keep it for their baby book. But it is just rotting tissue. So is there a need to keep it? Not so much. You can do what you want with that. If there's any concern about infection, and I'm going to tell you, I think that's the last thing you need to be worried about, because I've been doing this for 30 years and I've literally delivered thousands of babies and I've never seen an infected umbilical cord site. But if there's any concern, that would be a reason to call your pediatrician for sure. Okay, let me take a few minutes to answer your questions on bathing your baby, skin and nail care, changing diapers, and cord care. We're going to open up that live chat and you can type those questions in. There's a slight delay from the time that you start typing till the time that I get it. But I'm happy to answer those questions for you. Now, I know I'm going to get this question, so I'm going to hit it right head on while you guys are typing in your questions. Delayed cord clamping, big topic. So, what delayed cord clamping is just waiting a few seconds before you actually clamp the cord after the baby's born. So, the reason why we delay cord clamping is to allow enough red blood cells to get to the baby to prevent anemia. But there is evidence that if you delay cord clamping too long, that you could actually increase the risk for jaundice, like neonatal jaundice of the newborn. So what I tell people is, and there was a very good study that will back this up, this is very well evidenced, The Society for Maternal Fetal Medicine, the American College of OBGYN did a joint study, I'm going to say maybe 8 or 10 years ago, that looked at this specific topic, delayed cord clamping, and looked at it in intervals of 15 seconds. When the right time, right, the sweet spot for delay for cord clamping is, and what they found was about 45 seconds to 1 minute is the sweet spot. Delaying cord clamping past 1 minute can slightly increase the risk for neonatal jaundice, and actually clamping the cord too soon, immediately after the baby's born, actually increases the risk for anemia. So, what I suggest that you do is you actually speak to your healthcare provider, doctor, and midwife, and say, "Do you do delayed cord clamping?" It pretty much is standard practice. In all of my colleagues, we all do delayed cord clamping for 45 seconds to a minute. You want to ask your provider if they do that as well. Okay, now let me get back to these questions. I saw a question. I'm going to read them out loud so we can kind of learn from each other. Any tips on post circumcision care? Absolutely, Kristen. A little bit of A&D ointment, A and D, right? Vitamin A, vitamin D. A&D ointment, a little bit of A&D ointment on the tip of the penis every time you change the diaper for the first week after the baby's born. And that's it. There's nothing else you need to do. Just that A&D ointment on the end of the penis every time you change the diaper for 7 days. It doesn't take very long for it to heal, but the baby is very, very sensitive in the first 7 days. So you got to be careful about wiping that area. Like if you're changing the diaper, you don't want to wipe the tip of the penis. Great question. Um, what do you think about delaying baby's first bath until the cord falls off? That's 100% your choice, right? I always say your baby, your choice. Just know that baby can get a little bit stinky if you're delaying the bath for an entire week. But you could use even these water wipes just to kind of wipe the baby down if you wanted to delay the first bath until the cord falls off. I think it's completely appropriate. I didn't do that when I had my kids, but you certainly could. There's certainly not going to hurt the baby in any way. Okay, what will rashes look like in African American babies or mixed children? They'll look actually very similar than they do in a baby with lighter skin. So the rash is essentially the same. It's a little bit raised. The only difference is in a very dark African American baby, dark skinned baby, you won't see the sort of reddish color to it oftentimes, but you certainly can see the rash. It's actually very easy to see because it's a little bit raised and it's a little bit patchy. So it doesn't really change much. It's the redness is a little bit easier to see in a lighter skinned baby. Great question. How many weeks should I use the water-based wipes until I switch to baby wipes? Generally, we say 4 weeks or so, right? I think after that, you could certainly switch to like a Huggies or a Pampers wipe. And if your baby has no reaction at all to the fragrance in it, then you can go ahead and continue to use fragrance wipes to give the baby a nice little, baby scent. But some babies will react to the fragrance. And so then you have to stick with unscented wipes all the time. Okay. When can you introduce soaps for bathing? Yeah, so and increasing babies' frequency of baths. So usually once a week for the first 4 to 6 weeks, and then you can bathe your baby as often as you like. I don't think newborns really need a daily bath, to be honest, but that's your choice again. I didn't start bathing my kids daily until they were actually crawling, because then they were getting really dirty. I started doing a daily bath at that time. But yeah, you don't need to bathe them every single day. It's really going to be maybe every 2 days or so, until they're crawling around and getting dirty enough. And you can introduce soaps and bath products after 4 weeks. Okay, was the washcloth you showed us an everyday wash? Yeah, this is actually like an adult washcloth, right? It's fairly big. They make newborn washcloths that are about a quarter of this size, but this is just an adult washcloth. You guys, you don't have to buy everything that's specifically made for babies, right? You can utilize what you have at home for sure. Saves you a little bit of money. Can we not do nailing? I'm going to tell you that you do need to trim their nails. You want to know why? Because their hands go to their face all the time and they're going to start to scratch themselves. So, that's how you know when it's time to trim their nails, when you start seeing scratches all over their faces. So, you could choose not to, but it's eventually going to end up that the baby's going to scratch their face. So, really, you do kind of need to trim their nails. I think nail files are a very safe way to do that. Do you wipe baby's bottom with dirty or clean diaper underneath? Me, mom, Chris, this is what I do. When I have a dirty diaper, for example, I will take the diaper that's dirty All right, let's say this is my dirty diaper. Okay, this is my dirty diaper. I just opened it up. Oh my gosh, filthy, dirty diaper, right? I actually will take the first wipe, even if there's urine on this diaper, I'll take the first wipe, get off what I can, right, from the baby with the dirty diaper. I'll use it as my first wipe. Then I'll go ahead and I'll take one of my water wipes. And this is like where I'm actually doing my cleaning, right? Doing all my cleaning. I get rid of my wipe. I get rid of my dirty diaper. I usually just roll it right up. I put it in one little compact space. I close it up. This is just what I do, right? Cute. In the trash. This is also like if I'm out someplace, I don't have a trash can, I need to shove it back in my purse. Nothing's getting dirty. It's all, everything dirty is inside the diaper. And then I'll go ahead and I'll take my clean diaper and then put that on my newborn at that point. But that's a great question. Okay. I heard that you're supposed to wipe between the lips of a baby girl. Just curious if that was true, or do you do an overall wipe? You do not need to get into the little crevices. If you just do a top to bottom overall wipe, that will be enough. I think the mistake that new parents of girls make is they get a little bit too aggressive in the vaginal area, and that can actually lead to a little bit of a skin condition or a rash at that point. So you don't need to get in there and like really aggressively wipe. You can do an overall wipe of the vagina. There's really not a very big separation of the labia majora and minora in a newborn. It really looks very, very similar and very close together. So you're not going to get in a ton of crevices. When babies get bigger and their legs get super chunky, you do have to get in the crevices of their thighs. However, that's different. There's nothing cuter to me than like thick little baby thighs. Okay, let me see. What else? What else? You mentioned that you don't wash the baby with products, just warm water and a washcloth for the first 4 to 6 weeks. Absolutely. Okay, what do you do if baby's crying? You did everything that needed to be done. Yeah, you have to just allow baby to cry, comfort your baby, right? You got to think about what you have to do. Is the baby hungry? Has the baby been changed? Does the baby kind of need to be close to me? This is when the baby who's like really, really upset, this is where pacifiers, I think, are like a lifesaver. I think pacifiers will soothe almost any baby. A colicky baby is a little bit different, and you'd have to talk to your pediatrician about that. But for most babies, this is what works, a pacifier. Once everything's been done and your baby's just upset, yeah, pacifiers work wonders there. Okay, let's take two more questions here. Which baby lotion or cream is good to use on the face and body? So anything that's hypoallergenic and fragrance free, you can use, right? I would not start using lots of products before 4 weeks because their skin can react to that. Okay, so you just want to use hypoallergenic fragrance free lotions. There's the Honest Company makes a nice one. I used coconut oil. I didn't even use any kind of products until my baby was over a month old. So as long as it's hypoallergenic and fragrance free, you can go ahead and use it. Okay, one more. I'm having twins. I'm going to be extra busy. Yes, you're going to be extra busy, but I would say double the fun. Double the fun. Okay, is it the last question until we take a break? Is it okay to put a wipe over the penis as you change them to stop them from urinating in the air over themselves? Not even over themselves, but onto you as well, right? So we put like a little wipe over them or even a washcloth, or you know how like there's a little baby you know, like cloth that you put on so they don't spit up on you. That's what I used. I would undo the diaper of a little boy and put that right on while I got my stuff together. Because when you open up the diaper on a baby boy, oftentimes there's like a reflex. They will urinate. And all you have to do is be urinated in the face one time before you think, that's not a great idea. I got to find some way to prevent that. And that's a great idea, putting a little cloth over while you're changing the diaper. Great idea. All right, you guys, it is time to take a little bit of a break. I have 10:35. Why don't we come back at 35, 45, 50? Let's come back at 10 of 11. All right, 10 of the hour. And we will go ahead and continue with the second half of our class. All right, so we'll take a little 15-minute break. I will see you at 10 of the hour. And if there's any other questions that I missed, I'll try to answer those as well. Okay, see you in a few. Here we go. Let's talk about dressing your baby. So the average question would be, like how many layers do I put my baby in? And you do have to think about what's the temperature inside your house versus what's the temperature outside of your house, right? And do you need to change the amount of layers depending on where you are? Because the answer is sometimes, right? The generally accepted answer to how many layers do I put my baby in is one more layer than what you would normally wear. So for me, I've got one layer, I've got a little scrub top on. For my baby, it might be two layers, right? Maybe something light like a onesie, right? Like this. And then on top of that, I might put like a little sweater or something, right? So two layers. So one more layer than what you would normally wear is the like commonly accepted answer. Think about when we talk about favorite outfits, right? For newborns, and I'm not talking about favorite outfits in terms of like what they look like. I'm talking about comfort. So when when we dress newborns, we want to think about what is going to be comfortable for them, right? Onesies, sleep nightgowns, sleep sacks, things that are cotton in fabric. If it's cooler, fleece is actually not a bad option. You want to think about what's going to be comfortable for them because think about the uncomfortable things: headbands, tights, dresses, sometimes denim. Those are things that don't allow for a lot of freedom of movements with newborn. And so that can actually kind of impede their sleep a little bit. So you want to have them in comfortable fabric so that they will sleep a little bit easier. All right. So think about that when you're dressing your baby. There's lots of things that I think we think are really cute. They might be our favorite outfits, but they're not actually the best outfits to kind of keep babies from, keep babies from sleeping too long. We want them to sleep for a decent amount of time. So if we can squeeze out an extra couple of minutes, I think that's probably a better option than putting them in like a really cute outfit that we love and they're not sleeping as much. You guys, those first couple of months after you have a baby, you're so down on sleep, like you're so tired that anywhere where you can squeeze in a couple extra minutes of sleep are is going to be certainly appreciated. It's hard to imagine how tired you would be now, simply because you're not up all night. But once you're up all night, it's like you'll do anything for a couple extra minutes of sleep. So think about when we wash our baby's clothes. The most commonly asked question that I get is, can I wash my clothes with my baby's clothes? And I think in most cases the answer is yes. There is a but, right? So yes, you can, but how dirty are your clothes getting, right? Um how much soil is there on your clothing? If you are just wearing clothes everyday wear, I think it's fine. You can wash your clothes together with your newborns. But for example, if you work for the Department of Sanitation, or you work in construction, or maybe you're a scientist with lots of chemicals on your clothing, then I would say no. Obviously wash your clothes separately. So there's a little bit of common sense involved with that for sure. If it's everyday wear, it's fine. But if it's extra soiled clothing, right? Clothing that gets very, very dirty, then just separate it out and wash your baby clothes separately. You also want to wash your baby's clothes in something that doesn't have a tremendous amount of chemicals in it. So now there's a whole lot more options than there were, I think, when my kids were little, 20 years ago. But there's kind laundry. Um, I think the Honest Company makes a really nice hypoallergenic, fragrance free laundry detergent. And even the big companies, the big name companies, Tide, Arm& and Hammer, Gain, like the ones that you would find in like the big box stores, have a formula that's made for sensitive skin. If you're going to if you're going to wash your baby's clothes in something, use the sensitive skin formula, less chemicals, right? So we're trying again to minimize the amount of chemicals. And why? Like people ask me that all the time. Why does it matter? Like I wash my clothes in those things. Why do I have to be careful? It's not even good for us really, but the issue now that everybody is sort of facing are endocrine disruptors, right? Things that disrupt our endocrine system. We have to really start paying attention to the chemicals that are in our food, that are in our skincare products, that are in our laundry detergents, because that can disrupt our endocrine system, which actually, has a big impact on your hormones, your hormonal makeup, how unbalanced or balanced your hormones are. And it makes a big difference in our weight, right? It makes a big difference in our mood. It makes a big difference in, how often we contract diseases. So we do have to sort of start to pay attention as a society as a whole on how many chemicals we're ingesting or putting on our skin. And so, yeah, it does make sense for babies, right? Minimize the amount of chemicals. All right, time to dress our baby. This is what I want to show you. Again, this is just how I would dress my newborn. Okay, so I would turn and again, this is layer number one. This is going to be layer number one. This would be appropriate for a very warm day, 85, 90 degrees as the only layer. That would be fine. When I'm dressing a newborn, I usually tell new parents to turn the item that they're going to dress the baby in upside down. Make a very wide space for the baby's head, right? And then I'm going to turn the baby so you can see what I'm doing. I normally wouldn't stand to do this, but just to make it a little easier. All right. You're going to make a very wide space for the baby's head so nothing is touching the baby's eyes as it comes over the baby's head. Okay. Now, watch what I'm going to do here. I'm going to take my sleeve. I'm going to take my thumb and my index finger like it's a little pincher, and I'm going to bring it right through. Okay. I'm going to guide my baby's arm up. Now, this hand, I want to close all the fingers so that there's no fingers that are going to get caught. So I'm going to bring it up. I'm going to close all the fingers with my thumb and my forefinger, and then I'm going to use my free hand to kind of slide that sleeve right over the baby's fist. Let me show you that on the other side. I normally would not turn a baby on their side to get them dressed. This is just so you can see what I'm doing a second time. Thumb, index finger, go through, right? So you can see, guide the baby's hand up, close the fist, and then use your free hand to help guide the sleeve over the baby's fist. Then you can bring the clothing down, right? And then you're going to go ahead and attach it on the bottom. Super simple. Again, one person job. That does not take two people to do. You're fine to do that with one person. Now, here's what I want to say about these little onesies. On the bottom, this one happens to be Velcro. Most of the time, they are snaps on the bottom. And I'm going to tell you that you want either snaps or Velcro. You do not want buttons. There are some that come with tiny little buttons underneath. The buttons are like a nightmare. They're too small for the average size hand. And I have like tiny little thin little fingers, too small for even me to figure out. So if you're like a gentleman or a woman who has bigger hands, you're going to find those buttons so difficult to deal with. I tell people stay away from anything that has buttons underneath. It's always snaps or Velcro. That's it. Because anything with buttons is going to get either donated really quickly or end up in the bottom of your dresser, never to be heard from again. It's just really hard to maneuver that. Right? So super simple, right? Little easy mommy tips to help you get your baby dressed in the easiest way possible. Okay, let's talk about safe sleep. So, this topic could be a topic all unto itself, an entire class about sleeping, because there's very different opinions, I think, sort of in the childcare community about what the best way to have a baby sleeping is. All right. I'm going to tell you what the evidence says, what the American Academy of Pediatrics says, which is, the sort of governing body of infant care and child care. So, sudden infant death syndrome used to be a real problem, a real problem. I'm not saying that it's not a problem now. I'm saying that we've been able to sort of realize what was increasing the risk for sudden infant death, and we've been able to teach parents how to put their babies down to sleep in the safest way possible. In the early 1990s, when I first started practicing, we used to hear about sudden infant death all the time. Sudden infant death syndrome. Parents were like terrified. But what we found was then once we put babies on their back to sleep, and that was the campaign name, the Back to Sleep campaign. Um, and we were telling parents, we're not going to put babies on their bellies anymore. We're not going to put babies on their side anymore. We're going to put babies on their back to sleep. Once we started to do that, we learned very quickly that we were seeing fewer and fewer babies coming into the emergency room with sudden infant death syndrome. So The SIDS rate has decreased. SIDS is sudden infant death syndrome. The SIDS rate has decreased by over 80%. So that back to sleep campaign is a tremendously successful campaign, which still to this day is in effect, right? Everybody still says put the baby on their back to sleep. When you talk about room temperature, what's the ideal room temperature for a baby to sleep in? It's 65 to 72 degrees Fahrenheit. Now, look, if your house is 74 degrees, does that mean that you're at a significantly increased risk for sudden infant death? It doesn't. But what it means is you might need to adjust the layers on the baby so that the baby sleeps comfortably and isn't overheated, right? The opposite is true as well. If you tend to keep your house at 60 degrees, right? That's pretty cool. That's pretty cool. You might want to put an extra layer of protection on your baby to keep them warm enough. All right. Now you can see this newborn. I like this. I like this sleep sack. You can see this one has sleeves. Baby has one layer on underneath, and then has a nice sleep sack on over the top, which takes the place of a blanket. And we'll talk about blankets in just a moment. We do have a video on safe sleep for twins on our Instagram page. So if you want to check that out, if you are the mother of multiples, you can certainly check that out. So here are the ABCs with regard to reducing your risk for sudden infant death. Okay. The A is baby should be alone in their own sleep space, not in the bed with the parents, right? In their own sleep space, right? On their back is the B. And then the C is in a crib, or I would even say a bassinet, in the room with the primary caregiver, the American Academy of Pediatrics says for the first 6 months of life. Now, I get it. I know that not everybody has a room that's big enough to put a crib in. I know that not everybody plans to have their babies in the room for 6 months. I understand. What I'm saying is, this is what's recommended by the American Academy of Pediatrics. Obviously, your baby, your choice, but it is well evidenced that sudden infant death is reduced when babies are on their back in their own sleep space in the room with the primary caregiver for the first 6 months after they're born. The D is do not fall asleep with your baby on the couch. Let me say that louder for the people in the back. Do not fall asleep with your baby on the couch. I tell this story every single class that I teach because it happened. It was horrible. Those parents, their lives are forever changed, but I'm going to explain what happened. So, mom had a very, very long, exhausting labor, right? Dad was holding the baby, protecting baby's head. He was doing everything right. He was holding baby close so he could hear baby's breathing, burping the baby, and he drifted off to sleep, right? He fell asleep. Mom is asleep. He's holding the baby. Do you know that reflex when you feel like you're falling just before you fall into a deep sleep? You feel like you're falling. That's what happened. He had that reflex. He let go of the baby, and the baby toppled to the floor, had a skull fracture, right? Baby had to be transferred to a city hospital, and as they have lifelong complications from that fracture. So those parents would tell you that one step that they missed changed their lives forever. And the only step that they missed, because they were good parents and they were doing everything right and they were a lovely couple, the only mistake they made was to put the baby in their own sleep space when their little baby girl was tired, and devastating. So that's the D. Do not fall asleep with your baby on the couch. Put your baby in a bassinet to sleep. Okay, the E is early medical advice if your baby seems unwell. Chris, what does that mean? I'm just trying to get used to bathing and feedings and changing diapers and cord care. So, how do we know if a baby seems unwell? Well, maybe it's a little bit of intuition. Maybe it's a little bit of just checking and seeing what is different from what you know to be normal for your newborn, right? If your baby has been very awake and very alert and now is like this, and you can't wake that baby for any amount of love or money, then that may be an early warning sign that baby's unwell. The opposite is true too. If you have a very mild tempered, even tempered baby, and all of a sudden they're just screaming and everything that you've done has not worked, not that that means something's wrong, but it might be an early warning sign that something's up with your baby, right? That's something you'd want to check with your pediatrician about for certain. All right. So early on the earlier side, you don't want to worry about being that patient or I don't want to call or it's 11 o'clock at night, I'll call in the morning. We all have call rotations where we're on call. We expect to be called when we're on call. So if you have a question, you are not sure, I always say there are 9 to 5 questions, and then there are emergency questions. If your baby will not eat, if your baby will not sleep, if your baby is acting very differently than it normally acts, if your baby has a fever, those are any time of day or night questions, right? Can I get on an airplane with my newborn is a 9 to 5 question, right? And I know my pediatric colleagues will say you can call anytime for anything. I'm just saying there are definitely questions that it doesn't matter what time it is, day or night. You ask those questions, right? But if you said like I need a recommendation for preschools, and your child is 6 months old. That's probably a 9 to 5 question, right? It makes sense. All right. The F is foot of the baby to the foot of the crib, meaning that when you're lined up in bed and your baby is in their bassinet or their crib, that they should be in the same position that you're in. You shouldn't have the baby in the crib like this so that you pick your head up and look at the baby. You should be able to roll over and look at your baby. That way you can hear your baby's breathing a whole lot easier. So you usually put the crib as close to the primary caregiver as possible. And the G is get rid of everything that is loose or fluffy in the baby's sleep space because truthfully, they're all suffocation risks. So we think about a sleep space, a crib, like trying to make it look warm and inviting for a newborn. But a newborn doesn't know anything about stuffed animals or blankets or sound machines or anything. They know nothing about it. All they know is they need to close their eyes and go to sleep, and they need a safe space to do that. So we really don't need to put anything in their sleep space. We really don't. Those are things that we're trying to do to make us feel like we're creating a warm, inviting space for them, right? And that's the honest to God truth. So get rid of anything loose and fluffy. And take it out of their sleep space. So here's what we don't recommend specifically for sleep. We don't recommend pods, nests, or boppies. I think boppies are amazing as a breastfeeding positioner, right? A breastfeeding aid, but not to sleep. Why? Because that opening in the boppy, baby can sink into that. And what happens to their chin? Because they don't have good neck support, their chin can come down towards the actual chest wall, and then what happens there? Then baby suffocates, right? Because they can't lift their head up. So we got to be really careful about boppies. While I think they're great breastfeeding aids, I don't think they're great for sleep. We don't recommend pillows, duvets, or heavy bedding. We don't recommend hammocks, sleep positioner, or crib bumpers. Now, the caveat to all of this would be if a pediatric care provider says to you, I notice your baby has XYZ condition, and I'm going to recommend that you use a sleep positioner or a pillow for that condition. That's going to trump what I'm saying to you right here. If a healthcare provider makes the recommendation, you're going to listen to your healthcare provider. I am giving you general recommendations for the healthy newborn, no medical conditions whatsoever. We just don't recommend these things specifically for sleep, right? But if you get a recommendation from your doctor, your midwife, your pediatrician, you're going to follow those directions. Pediatric nurse practitioner, sure, you're going to follow those directions. All right, let's talk about safe swaddling. All right, this is a really hugely important topic. This is a blanket that we use at the hospital where I deliver babies. It's just a big square baby blanket. You can see it's very, very thin. This is not a thick blanket at all. It is cotton. So when we talk about safe swaddling, it used to be that we would say swaddle your baby to mimic the intrauterine environment. Swaddle them really, really tight. And the guidelines about that have changed significantly. We do not swaddle babies very tightly anymore. We actually put them in quite a loose swaddle. So we use a light breathable blanket, very similar to this one. We want to make sure that it is not too tight. When we were swaddling babies very tightly, what we were finding was that they were unable to move their legs properly. We were inducing hip damage simply by trying to mimic the intrauterine environment. But it makes sense. Once the baby comes out of the uterus, they should be able to move, right? So medicine is never perfect and it's always evolving, and so is science. And so we make the adaptations where we need to. So your swaddle should be loose, not too tight. We want to avoid hip damage. And you want to keep the neck and the shoulders, right? And the head free of the swaddle to avoid any kind of choking risk. So once your baby can roll over, and that is different ages for different babies, but once your baby starts rolling, you take the swaddle away. You don't need to swaddle them. And really, listen, I get asked all the time, do I need to swaddle my baby at all? The answer is no, you do not. But most babies will be very comfortable in a swaddle for the first couple weeks after they're born. And once they start sort of wanting to move their limbs a little bit more, they start to kick themselves right out of the swaddle. And I usually say, once they're doing that, just get rid of the blanket because then it becomes a choking risk. So, generally, the way that you do it is you take a corner of your blanket and you fold the corner towards the center. I'm going to show you this. All right. Then you take your newborn, always supporting their head, and you line up their shoulders with the crease in your blanket. Okay. Then you're going to take one corner of the blanket and you're going to tuck it in, right? Loosely. This is very loose, not super tight. I'm going to take the bottom part of my blanket, bring it up, and I'm not up over the baby's head. I'm going to pull back if I need to. And then I'm going to take my third corner and I'm going to bring it around. Now you can see with this baby, the head, neck, and shoulders are free of the swaddle. Hands can come up to baby's mouth if that's what she wants to do, right? But there's enough support around the baby to give a little bit of like a snuggly type of a feel. That is essentially considered safe swaddling. We're not doing like super, super tight swaddles anymore. Let's talk about some of sleep sacks, baby sleeping bags. Sleep sacks are what I call them. Sleeping bags are fine. TOG values, TOG, which means thermal overall grade, is something that's not used all that much in the United States. It's used a little bit more overseas, but we do teach classes overseas, so we're going to include the slide. I'm just going to give you sort of an idea of what it means. So, thermal overall grade is a numeric value that's given to describe what fabrics are appropriate for what temperature. So if you look at this actual slide, you'll see that a TOG rating of zero point 0.2 is something that's going to be very thin and meant for much, much warmer temperatures, right? And then as you get to a zero point 0.5, a 1.0, a 2.5, we start to see that we're using more multiple layers, right? Or we're changing the actual fabric that we're using from maybe cotton to fleece, especially as you get into a thermal overall grade of a 3.5. And that's something that's usually on the tag of the clothing that you're buying. It'll say TOG value 3.5. Now, again, in the US, you're not going to see it all that often. But if you see something that says TOG 3.5, it's meant for cold weather, right? If you see something that says TOG zero point 0.2, it's meant for warm weather. So it's just a matter of a way to measure, what types of fabrics belong in what temperatures. All right, let's talk about temperature control. All right, we had talked about earlier that we said that you want to dress your baby in one more layer than what you would normally wear. Then we're going to use an appropriate sleeping bag or sleep sack when the baby's sleeping. Now, first 2 or 3 weeks, that might be a swaddle, right? After that, I usually say get the baby out of the swaddle and go ahead and put them in like a sleep sack. Halo makes a nice sleep sack. There's so many companies that make sleep sacks and there's not one that's better than the other. I said Halo because that's what we, use at our hospital where I deliver. So I think that whatever fits in your budget. There's sleep sacks in every different budget. I just think it's what works with your budget. But then when they're sleeping, we're going to put them in a sleep sack. Know that your baby's circulatory system is much stronger in this area, the very midline of the body, because that's where all your vital organs are: the heart, the liver, the lungs, the kidneys. So there's going to be much more blood flow in this area of your baby's body than there's going to be like in their hands and their feet. That's to be expected. And the result of that results in hands, feet, noses that are a little bit colder, right, than the midline center of the body. So it is normal for a baby to have cold hands, cold feet, cold noses. We expect that. And then if you're worried about your baby's temperature, your baby's overall temperature, your parents might say, oh, put your hand on their forehead, right? That's how I used to check your temperature. But we just said what hangs furthest away from the core of the body is going to be cooler. So checking your baby's temperature with their forehead in your hand is not the greatest way. You want to actually feel a baby's core temperature by putting your hand, undressing them. So not over their clothing, under their clothing, putting your hand right there, midline of the body, midline of the back. If they feel warm here, then for sure you want to make sure that you're taking a temperature and you're going to see what the temperature is. A normal temperature for a baby, a newborn, is going to be somewhere around 97.7 to 99.5. Here's what you want to ask your pediatrician. Big question to ask your pediatrician. At what point would you want me to call you? What do you consider a fever? The reason why I'm saying that is because of all my pediatric colleagues that I work with, and I respect each and every one of them. They have very different opinions about what's considered to be febrile or a fever. Some of my pediatric colleagues want to know when a baby's heart rate is, not heart rate, temperature is 99.5 or above. Some say, I don't need to know until it's 101. I have another colleague that says anything over 102, I need to know about. So you want to ask your pediatrician, at what point do you want me to call you? When the baby's temperature reaches what? Like, what do you consider a suitable temperature to be calling you for? Okay, make sure you ask your pediatrician that question. All right, just another little discussion on our ultimate childbirth class, because we do want to make sure that we get you this information. We're so passionate about teaching this information. We want you to be able to watch that class and see it for free. There is a process, so let me go through what that process is. So what you do is you actually book and pay upfront for the ultimate childbirth class. It's $129 at checkout. We will email you a receipt for that class, which has all of the required and relevant information that your insurance provider is going to require in order to reimburse you for the class. Almost every insurance carrier will reimburse for childbirth education. That was part of the Obamacare Act, I think, many years ago, right? 6, 7, 8 years ago. So reimbursement is, I don't want to say it's mandated in every insurance, but it is common in most insurance plans. So you send the receipt that we give you along with your policy details to your insurance provider, who will then reimburse you for the class at 100% of what you paid. If you're having trouble getting your reimbursement from your insurance company and we can't help you, we will go ahead and reimburse you the $129 ourselves. All right. So we feel really confident about what we're teaching. We feel really comfortable with the information and we want you to be able to access it. So if you book that class by midnight tonight, we're going to go ahead and include the baby first aid class for free. And what's more, we're going to go ahead and put that baby first aid class in with your childbirth education class. So you only have to take one class. You don't have to split it up into two classes, right? I know I have a busy schedule. I am sure that you have busy schedules, and we want to make it convenient for you to be able to take that class. So, again, to get the baby first aid class for free, you're going to book and pay for that class before midnight tonight. All right, Saturday, July 1st. Now, here are some upcoming childbirth class dates. Take a look at those. You may want to make a little screenshot of that. If you find a date that works for you and there's only one or two places remaining, I would say go ahead and book it. And if it turns out that it's not a good day for you, we will move you into a class that's more convenient for you. Right. So again, you book that by midnight tonight, and we will throw in the baby first aid class for free. All right. There should be a little button that pops up that says book for free now. And then you can go ahead and press on that. I will not disappear. You have me for another 9 or 10 minutes or so, but yeah, I will certainly minimize and go into a different screen, and you can go through the process of booking for that class. I want to address some of the other questions that I got that I couldn't get to before. And one of those was, when with little girls and blowouts, and I'm assuming you mean like diaper blowouts, not blowouts on their hair, because newborns don't have that much hair. How much is too much to wipe the vaginal area before a bath? I would say if you're going to put the baby into a bath, it's one quick wipe. And then you can put the baby into a bath and let the water do the rest of the cleaning for you. You just want to wipe one time front to back. Now, here's what I'm going to say about blowouts. Blowouts really don't happen all that often until babies are much bigger, right? Because we're changing their diapers so frequently that we don't have time because they're eating smaller amounts in more frequent intervals that we really don't see those big, huge diaper blowouts. So, what I would do is clean off the area as best as possible. That's not digging in the crevices or doing anything like that. And then go ahead and put the baby in the tub and go ahead and finish the bath off there. But you're really not getting blowouts until babies are like several months old. So, in the very beginning, it just doesn't happen all that frequently, but it's a great question. Okay, let's see. I want to take your questions now. We have about 8 or 9 minutes. Any final questions? Now, I'm happy to take your questions about sleeping, swaddling, dressing your baby, or laundry questions, things like that, or any other questions that you might have. I'm happy to answer those questions now. Okay, let's see. Should I cover baby's hand with anything to avoid it scratching itself? Yes. So here's what I'll tell you what I like and what I don't like. There are long sleeve t-shirts that have a little flap at the end that you can pull the flap over the hands that act as mittens. Mittens per se, I don't like separate mittens. Do you want to know why? Because a baby's hand can go to its mouth, baby can pull its hand away, and that mitten can stay in the mouth, and then you have a baby that suffocates just because you're putting mittens on your baby. So I don't like mittens, but I do like the long sleeved t-shirts that they have for babies that have the little flap that you can pull over that acts as a mitten, right? Because as soon as baby pulls their hand away, the fabric that's over the baby's hand is going to go with the arm because it's attached to the sleeve. Does that make sense? So while I can understand what you're saying, want to protect the baby from scratching its face, the best way to do that is keep the nails nice and short and use a longer sleeve t-shirt that has that little flap that you can pull over so that they can't scratch their face. Okay, should I hand wash a baby cloth or can I put baby cloth into the washer and dryer that you use? You can put baby's cloths into the washer dryer. If you're using ones that are specifically made for babies, sometimes they're so tiny that they can get stuck under the agitator and that can actually break your machine. So in those cases, if you're using a really small infant washcloth, you might want to just hand wash it. But if you're using like what I'm using, which is just an adult washcloth, you can throw that right into your wash, the same wash that you use for your clothes. Okay, let's see. How frequent should I change the baby cloth? So, baby cloths I actually change with each bath. I go ahead and change it with each bath. If you're going to wipe dirty diapers down with something like this, I would change it with each diaper change. That's why I don't use these for diaper changes. I use these for diaper changes, right? So you'll go through a ton if you're every time you're wiping down poopy diapers, you have to get a new washcloth. You're going to go through it like, how many 10 or 12 washcloths a day. It's a lot. Certainly your choice, however. How about those pillows with a hole in the middle? Not recommended. They're not recommended. No pillows are recommended at all. And I know what everybody's concern is. How do I prevent that baby flathead plagiocephaly? One of the easiest ways to prevent that is to actually engage in something that's called baby wearing. Have you ever heard of this? It's when you have like a big wrap. This is, certainly not going to be big enough, but I'll give you the idea. It's the baby wraps are much bigger than this, but they actually go around the mother and they usually tie up here so that when your baby is sleeping, right? Your baby can sleep. It's called baby wearing, right? And the baby actually sleeps right next to your body. And you can do one or two of your baby's naps right there on you. That's going to see, that's why it has to be tied because you don't want to drop them. If you can do one or two of those nap sessions with your baby, you're wearing your baby with one of those big wraps, then you're not going to have your baby flat on their back every single time you put them down in their crib. But anytime a baby goes in a crib or a bassinet, it is to be on their back. Okay, let me see what else. Oops, hold on. That's my last slide. What coconut oil do I recommend? So honestly, I don't have like a favorite coconut oil. I have used the coconut oil that's actually solid, right, and just rubbed it between my hands so it actually becomes nice and warm and it moisturizes. I've used those. I've used fractionated coconut oils. There's not like a brand that I think is one is better than the other. I just think coconut oil tends to work better than other natural oils. Great question. Clarice, do we get the slides from this class 100%? Yes, you will get the slides. Any tips for sleep training? Candace, here is my, write this down. I know I tell you don't write anything down, but if you're going to write anything down, write this down. Two books that I think are literally the best books ever made for sleep training. One is called On Becoming Baby Wise. On Becoming Baby Wise, the authors are Robert Buchanan, Buchnan, and Gary Ezzo, Ezzo. That is, I had heard about that book over and over and over again from parents about sleep training. And so I bought the book. I read it and reread it and reread it with each one of my children. I have four. All of my children were sleeping through the night 12 hours from 9 weeks of age on. If that only happened with one baby, I'd say it's luck, but it happened with all of my babies. So I would say, nope, it can't just be luck, right? So that's a great book on sleep training. And the Baby Wise books are a series. So it's on becoming baby wise, on becoming toddler wise, on becoming child wise, on becoming teenage wise. All of them were fabulous. I thought they were all great books. I'm going to say that I don't get a dime from these authors for recommending their books. I'm just telling you that they're great books. The other one was called Secrets of the Baby Whisperer, very similar in terms of the principles for sleep training in both books. I cannot remember the author's name on Secrets of the Baby Whisperer, but I think that's the only book by that title. Both are great, great books that sort of talk about sleep training and feeding and how it all plays out. Talks about demand feeding for the first 4 weeks, and then you start to do parent directed feeding as opposed to infant directed feeding, which for me worked like a charm. All right. So would you, okay, let me see. Kaylee says, so would you all free and clear laundry detergent? Would I use all free and clear laundry detergent? Yes, I would. Do you use fabric softener? Some people are really attached to fabric softener. I wasn't. I don't love fabric softener because it really is a lot of chemicals in the fragrance. So I don't use it. I never used it. Could you use it? You could. It's just a little bit more chemical exposure for your newborn. Okay, Akeem is saying, what about not cutting the placenta? That's called a lotus birth. That means that your baby stays attached to the umbilical cord and the placenta until the umbilical cord actually separates from the baby at a week, 10 days of age. So that 100% is, your preference, your choice. What I would ask is just talk to your pediatrician about it and talk to your OBGYN about it and make sure that they're both comfortable with doing that because it does increase the risk of neonatal jaundice for the baby. All right, when picking a bassinet for next to our bed, should we pick one with a changing table attached or one without? There are so many options. I'm going to tell you another book. Write this one down. And this is real. This was very helpful for me because I too felt like there were so many options. There's a book that's called Baby Bargains. I don't know the author's name, but they update it every couple of years. So it's called Baby Bargains. And it's a great book that looks at not only what's on the market currently, but it also looks at the safety features of each product. It gives reviews by parents on each product, the price point for each product. And for me, it was a great resource to be able to see what parents had said that they liked and didn't like about the products. And it gives a grading, like an A, a B, a C, or a D. So it gives you a little bit of confidence that what you're picking is actually highly rated. So I liked that book. Baby Bargains was fantastic. Okay, one more question, then I have to log off, guys. Okay, someone asked this earlier. One bath recommended per week, but sponge washcloth baths daily. So the areas that are getting dirty on a daily basis, you're going to clean daily. Their face, their hands, right? Obviously, their buttocks and their vagina or penis when their diapers are clean or dirty, wet and or dirty. But a head to toe bath only once per week. Okay. Oh, wait, I'll answer this one too, and then we'll go, guys. Kind of off topic, but what's your opinion on breastfeeding versus formula? Okay, I'm going to say this first. A fed baby is the best baby, right? Fed baby. I think that you cannot duplicate with formula what is in the breast. So, breast milk does have properties that you cannot find in formula, antibodies that you cannot find in formula. That being said, when women struggle with breastfeeding, I think that formula is a very acceptable option. And I think we just have to, again, be willing to flip the switch and know that we're feeding our baby. And that's the most important thing. Okay. All right, guys, we're right on time. I hope you learned a little something today. We'll see you in one of our childbirth education classes. Enjoy the rest of your weekend. Thanks for spending your morning with me. Have an amazing day. Take care. Bye bye. Happy 4th of July.